Good afternoon, and welcome to the first Social Services Subcommittee meeting of 2026. Thank you so much to everyone for being here. Please mark your presence on the electronic board. I don't think it's all popping up. Is it not working?
At least have two. Hang on.
All right, Madam Clerk is going to see if we can fix our connection. All right.
You know what?
Can we do oral voice roll call? Just 1 second as we get. Oh, here it comes back up. Oh, the same people are still on the board.
Shin.
Present.
Gardner.
Present.
Henson.
Here.
Cohen.
Here.
Cole.
Here.
Walker.
Present.
Cornett.
Present.
Willett.
Here.
Here.
Tran. Okay, so you have a quorum.
Great. We have a quorum, and now we're going to get started.
Okay.
We have a couple of administrative tasks first. 1 second.
All right, I got to get out of this.
All right, we have several bills where the patron has asked that we take them by for this week. House Bill 87 from Delegate Laufer, House Bill 297 from Delegate Siebold, House Bill 425 from Delegate Livier Bowling. If I can get a motion to move those by in a block. Okay, that's been motioned and properly seconded. All those in favor, please say aye. Aye. Any opposed? Okay, those three bills are now by for this week. We also have, 1 second, let me put my notes. All right, we are going to take up Delegate Clark's bill first. So before us, we'll have House Bill 280. Welcome, Delegate Clark.
Awesome, good evening. Oh, is this on? There we go. Good evening, Madam Chair and members of the committee. Today, I am presenting HB 280. This proposal is simple but a powerful idea, is universal access to health care for children, free at the point of use across our state. Right now, millions of children across the United States lack consistent or adequate health care coverage. During the COVID emergency, there was expanded protections, but they were temporarily closed that gap. But as those protections begin winding down in 2023, children have once again started losing coverage. Undoing years of progress. When children lose coverage, they don't just miss checkups, they miss early diagnosis. They miss mental health support, and small, treatable problems turn into lifelong consequences. HB 280 prevents that backslide. This bill will draws on proven models like the Beverage and National Health Insurance System, while building on programs we already have. It doesn't reinvent healthcare, it strengthens it, using evidence-based strategies that increase enrollment and public understanding so families can actually access the care they're entitled to. We don't have to guess whether this works. In September 2025, New Mexico became the first state in the nation to guarantee free healthcare for all children. That decision wasn't reckless. It was informed by data, public health expertise, and the understanding that investing early saves money later. International evidence reinforces this. In Australia, pediatric providers reported that universal health care allowed them to engage more authentically with families. Parents were better able to manage their child's health. Providers had stronger working relationships. Care became proactive instead of reactive. This isn't just about coverage, it's about trust, continuity, and outcomes. And the American Academy for Pediatrics supports universal coverage for children for a reason. Healthy children are more likely to succeed in school, less likely to require emergency intervention, and more likely to become healthy, productive adults. Now, opponents of this bill will argue that it costs too much, but we should ask the question, what does it cost us not to act? When children lack preventive care, the state pays later through emergency room visits, unmanaged chronic illness, special education needs, and lost economic productivity. Preventive pediatric care is among the most effective investments our government can make. Universal coverage reduces administrative waste, improves early intervention, and lower long-term expenditures. In other words, HB 280 is not a drain on state revenues, it is a strategic investment. Healthcare should not be a privilege that children age into. It should be a foundation that is given from the start. HB 280 says that in Virginia, we believe children matter more than bureaucracies. We believe prevention is smarter than crisis response, and we believe that a child's future never should be determined by whether their parents can afford a doctor's visit. And I hope it will be the will of the committee to support the bill.
Great. Thank you so much, Delegate Clark. Are there any questions from our committee members? You can use the request to speak button. Delegate Cornett.
Thank you, Madam Chair. Question for the patron. Is it my belief that under the current laws we have, many or most children in the Commonwealth are eligible either for Medicaid or CHIP? Could you give me some instances that this would cover outside of that?
Yes, I can. Actually, I probably can phone a friend and they can explain it a little better for you. Is you all right?
Thank you, sir.
No, thank you.
Good afternoon. If you can please let us know your name and which organization you're representing.
Thank you, Madam Chair. My name is Bjorn Coxvold, and I work at 4Kids. We're a nonprofit down in the Hampton Roads region. We're one of the largest nonprofits serving homeless children as well as families experiencing poverty. What I will tell you, sir, is that because there are so many gaps, we actually have to hire a full-time health coordinator that is reaching out to other nonprofits throughout the region to try to pull in things like mobile clinics that will do free service, that will come to us and provide those things. We have a dentist that comes by once a month right now to provide free service to our children as well. So there are significant gaps currently in the coverage as we speak.
Great. Thank you so much. Are there additional questions from members of our committee? Okay. I don't see any hands up right now. Are there folks in the audience who wish to speak in support of this bill? If you can line up.
Again, my name is Bjorn Coxvold. I'm the Government Relations Manager at 4Kids. And I've already said who I am and who 4Kids is, and we support the bill. So I'm actually going to reintroduce myself. My name is Bjorn Coxvold, and I'm a citizen of Virginia. And I would like to share a story with you. 2 Christmases ago, I visited London with my 2 daughters and my wife, who's an officer in the Navy. And we went there for Christmas. And it was a beautiful trip, core memories made. But what I will tell you is my daughter got really sick 2 days before Christmas. I have never experienced my child's temperature going through the roof as quick as it did. And we panicked a little bit. My children have never ridden in an ambulance before, and here we were. My wife with my youngest child riding in an ambulance in a city that we had never been to before. As I sat there with my older daughter at the house that we had rented, that thought that should have never crept through my head crept through my head. We had just bought on Christmas gifts. We had just gone on vacation. Could I afford for my child to be sick? Now, I'm happy to say this has a happy ending. A few shots later and a little bit of steroids. Turns out hospital beds were filled in London that night with kids that had caught a virus throughout the city. But my daughter got really well, and we had probably the most memorable Christmas that I think I will ever remember. But what I hope is that you take from that is London didn't ask the question, does my child have insurance? London didn't ask the question if I was even a citizen. The number one thing that they thought about was, this kid is sick, and we need to make them better. And that's what I would want out of my Commonwealth. That's what I would want you to use my tax dollars for, is I want the Commonwealth to care for kids. Thank you very much.
Great. Thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the subcommittee. My name is Mackenzie Huff, and I am a pediatric resident at VCU. I am speaking to you today on behalf of the American Academy of Pediatrics in support of House Bill 280. In Virginia, there are 9,000 infants, children, and adolescents without health care coverage. This results in children suffering unmet health needs and poorer health outcomes. The lack of access to care creates a barrier to well and preventative care services, as well as the management of acute and chronic medical conditions. By providing children with health insurance, we can improve their medical, dental, mental health, and educational outcomes. For these reasons, I hope you support this legislation. Thank you.
Thank you. Can I ask you a question before you go, please? I'm sorry, you said there were 9,000 kids without health care coverage in Virginia. Did you have an age range for them, or is that 0 to 18?
I think it's under 19.
Under 19. Great, thank you. Good afternoon.
Good afternoon, Madam Chair, members of the subcommittee. I'm Gonzalo Ida with the American Heart Association, and we support the bill. Thank you.
Thank you so much. Are there any folks in the room who wish to speak in opposition to this bill? All right, I don't see anyone. Members of the committee?
Madam Chair, I believe there.
Oh, are there folks online?
No, not online, but I think there was. I would love to entertain a motion to make this a study.
Oh, yes, thank you so much, Delegate Clark. I think Delegate Chin was trying to jump in.
Oh, I'm sorry.
Well, before I make the motion, Madam Chair, if I may, I want to thank the patron for bringing forward this bill. I think the gap that there are 9,000 kids in the Commonwealth who are without health insurance is a problem that we should try to address. And so I really appreciate you bringing this forward. I also just want to acknowledge how being able to provide preventive care is a way in which we can lower healthcare costs for everybody in the Commonwealth, and that this is a measure that is not just, I think, morally good for us, but also it's good for our public health in the Commonwealth. So thank you for that. And so I understand the motion that I think the motion that I'm going to make is to gently lay this bill on the table with a request to the Uber chair of the HHS committee to write a letter for a study so that we can better understand what's happening in the landscape, to come back next year with a bill that will probably better be more specific or better tailored to address this need. And so with that, that's my motion, Madam Chair.
Second.
All right, there's been a motion to gently lay the bill on the table and ask the Uber chair to send a letter to DMAS so that we can better kind of get our arms around the 9,000 kids who don't have health insurance and why that is and what is the best way to proceed as our state, and how do we invest our resources into some of the most vulnerable of those kids, perhaps. And so I really appreciate Delegate Clark for being open to that idea so that we can continue this conversation that's so important. That motion has been properly seconded, and it is before us to gently lay the bill on the table. Madam Clerk.
Yes, sir, ma'am. Just give me 1 second.
Okay, 1 second for the IT to catch up with us. And please cast your vote. Oh no, it's not working. Madam Clerk, I think the IT is not working for us.
I don't know what's going on with the computer
Okay.
today.
Would you be able to take our vote orally? Great.
I'm just having technical difficulties.
Yes. All right.
Okay.
The clerk is going to call for the vote. Thank you so much for bringing this issue to our attention, Delegate Clark.
Thank you,
Appreciate
Madam Chair and members of the committee.
Thank you. Next, we have Delegate Atusa-Reeser.
Okay, we'll just see what happens with this. Okay, if we keep having problems, I gotta get talk to somebody.
Good afternoon, Madam Chair.
And then I think this is House Bill 794.
Good afternoon. There is a substitute. May I speak to the substitute?
Yes, please do.
I'm sorry, an amendment.
An amendment.
Yes,
Okay.
some line amendments, changing the word, striking the word opioid throughout the bill and changing it to the word drug. And that was at the recommendation of EDH.
Could you repeat? So changing the word opioid to the word
striking the word opioid and using the word drug
Okay.
at the recommendation of the Virginia Department of Health.
Great, thank you so much. Can we get a motion on the amendments so that they're properly before us?
I'd move adoption of the amendments, Madam Chair.
Right, all those in favor say aye. Aye. Any opposed? Great. The bill as amended is now before us.
Thank you, Madam Chair. This bill deals with fentanyl overdoses. Fentanyl overdose deaths remain significantly higher than when Virginia first declared the opioid crisis a public health emergency, despite recent efforts and declines. Virginia's response to the opioid and fentanyl crisis is spread across numerous state agencies, programs, and initiatives, with no single entity clearly responsible for the coordination. And while many evidence-based programs exist, there is no formal structure to align the goals, to share the data, or evaluate effectiveness across these agencies. And the lack of a unified strategy, we believe, has created inefficiencies, made duplicative efforts, and created some gaps in services. So it is a recommendation from the Joint Commission on Healthcare after a study had been done to look at policy solutions to the fentanyl crisis, to both a bipartisan and unanimous recommendation of the JCHC to designate the Virginia Department of Health as the Commonwealth's lead agency for comprehensive opioid response. This bill would do 5 things with that in mind. It would do 4 other things besides designating the VDH. It would authorize VDH to convene and coordinate relevant state agencies involved in prevention, treatment, harm reduction, enforcement, and recovery. Second, it would direct the creation, implementation, and monitoring of a statewide strategic opioid response plan. Third, it would leverage VDH's public health expertise and data capabilities to guide evidence-based decision-making. And lastly, it would improve coordination, accountability, and effectiveness of the Commonwealth's ongoing efforts to address the opioid and fentanyl crisis.
Thank you so much, Delegate Reeser. Are there any questions from our committee? Oh, I see a couple of hands up. Delegate Henson.
Thank you, Madam Chair. My question is to Council. By changing opioid to drug, does that change the nature of this bill or what we're trying to do here?
Madam Chair, Delegate Henson, it includes opioid, and also there's a part in the substitute where there's an inclusion of drug overdose or opioid overdose deaths specifically as well, but it widens the scope to apply more broadly to drug overdoses generally and not specifically to opioids.
Thank you. Madam Chair, follow-up.
Delegate Henson?
Thank you. And for the patron, is that your full intent of widening the scope for this?
Madam Chair, I would answer the delegate yes.
Thank you. One final question, Madam Chair.
Delegate Henson?
And if this bill reports, does it have to go to appropriations?
Yes, it does.
Thank you, Madam Chair.
Thank you. Delegate Cohen, was your hand up?
It was, but
You're good? Okay, great. Are there any other questions from our committee? Okay. Are there any folks in the room who would like to speak in support of this bill? Are there any folks who would like to speak in opposition to this bill? All right, so the bill's back with the committee. And as we just noted, we did get a request that this bill be sent to appropriations if it is going to be referred out of our committee.
Madam Chair, I move adoption or to report and refer to appropriations.
Second.
As amended. Substitute.
Second, all of that.
All right, so there's been a motion to report the substitute and refer to appropriations. That's been properly seconded. All those, can we open the roll? Sorry.
it's going to take, she's
not
telling
working?
me it's probably a Microsoft issue.
Okay,
So let me
let's
get
just do it
another-
by,
yeah.
I understand. Outlook is down.
all right, thank you. As we wait to pull out our, back to the handy dandy paper and pencil method.
Okay, sorry, but we're having reported that there is a Microsoft issue. It's reported that there's a Microsoft issue. Apologize to everybody. This is on
House Bill 794.
794, it's report and refer to
As substituted.
appropriation with the substitute.
Yep.
Okay. Shin.
Aye.
Gardner.
Aye.
Henson.
Aye.
Cohen. Cole. Walker. Cornett. Tran.
Aye. Thank you so much, Madam Clerk. Delegate Reeser, your bill is recommended to report and refer to appropriations unanimously. Thank you so much for your time this afternoon.
Thank you, Madam Chair, and to the committee members.
All right, I'm going to call up Delegate Ballard.
It's not working. It's just not. I don't know what's going on.
Okay, before us, we have House Bill 103. If we vote favorably on this bill, we would also need to refer it to appropriations as well. House Bill 103, go ahead.
Thank you, Madam Chair, members of the committee. So HB 103, pretty simple in the text. It's only a few sentences long, but basically it directs the Department of Behavioral Health and Developmental Services to take all steps necessary to implement Part C of the IDEA, which is the Individuals with Disabilities Act, in order to allow children 4 years of age or younger to receive early intervention services. Currently, as I'm sure you all on this committee know, it only covers children age 4. And last year, the department served almost 24,000 children and their families with early intervention. And so what this bill will do, quite simply, is just expand services to children under the age of 4. Early intervention services are designed to meet the developmental needs of an infant or toddler with a disability, either physical, communication, adaptive, or social or emotional development. So expanding this program will provide more children as well as earlier in their life with necessary assistive technology, audiology services, family training, counseling, home visits, health, medical, mental health services, nutrition, occupational, physical therapy, special instruction, speech, language, pathology, transportation, vision, and I'm sure many more. As you all, I'm sure, would agree, they're reaching these children early in their lives, often during a very critical period of development, will provide them with support and tools they need for success, often in school, and Delegate Reeser and I were talking about this. So if you provide it early in school, it often reduces the need for more costly interventions later on. So that's basically the bill. I do have a few people here to speak in support, and I hope this committee will act favorably upon it and report it out of this committee.
Great, thank you so much. Are there any questions from our committee members? Delegate Henson.
Thank you, Madam Chair. Question for the patron.
Go ahead.
Just to confirm, if you can restate the reason why we're moving this from 3 years of age to 4 is to draw down the federal dollars, correct?
So this would take it for services under the age of 4.
Okay.
So birth to 3 plus, almost 4.
Thank you, Madam Chair.
Are there other questions from the committee? Okay, I don't see any hands up, but I do have a couple questions, Delegate Ballard. Currently now, I think there were some movement in the past handful of years to increase reimbursement rates for the service providers. Are you aware of, or do you have a phone a friend who can tell us, are there enough service providers to meet increased demand if we, expand the eligible population?
Yeah, Madam Chair, I think that's a great question. I personally don't have that knowledge. This is candidly not my wheelhouse. I'm sure there's someone in the room that may have the answer to that, but I think that's definitely a question that needs to be answered for sure.
Is there anybody in the room who could answer that question, a subject matter expert on that?
I have no friends in the room, Madam Chair.
All right.
So
All right. Well,
that is often the case.
Well, we will put a pin in that question, but yes. Oh, you're back. Okay. Are there, I don't see any other questions, hands up for questions right now. Are there any folks in the room who'd like to speak in support of this bill? Good afternoon.
Madam Chair. Members of the committee, my name is Bergen Nelson. I'm a general pediatrician here in Richmond. I came here to support another bill, but I moved to support this one because I love early intervention. This is the area of my research. Early intervention is one of the most effective things we can do. And as pediatricians, it's hard because things kind of fall off a cliff at age 3. As soon as a child turns 3, we have fewer options. I love our support Part C program because we have an online referral system. It's smooth, it's easy. I do not know the facts of that workforce. There's quite possible that there is a workforce shortage, but I do not believe that that's a reason not to support it. If we provide more resources, I believe that we could draw more people because early intervention is very different than what happens in the early childhood special education program. It's family-centered. It happens in the home. Families love it. Providers love it. I've seen positive outcomes, and I would strongly encourage you to support this.
Great. Thank you so much. Good afternoon.
Madam Chair, delegates, Jennifer Hubert with the Virginia Society for Human Life. We're very much in support of these kinds of early intervention things, especially revolving around disabilities and things like that. So we hope that you'll support this bill. Thank you.
Thank you so much. Are there any folks in the room who wish to voice opposition to this bill?
I'm in favor.
Oh, you're in favor? Okay, you can. We'll backtrack to the folks who are in favor of this bill. Come on up. Good afternoon.
Yeah, I wasn't going to testify, but now I wanted to share my personal story about how this bill would have assisted me and my daughter. My name is Dr. Elise Osterweil. I'm the mother of an 11-year-old child and who was abused by her father since the time of her birth. And he threatened that he would kidnap her if I didn't obey, if I didn't wear what he wanted, eat what he wanted, stay in the home. I have my PhD, and so this had an impact on our infant and child. And so by the time that she turned 15 years old, she was regressing in her speech. She was speaking. She was, I've never seen. Well, she's my one and only, so I'm a little biased because she's my kid, but. It was just extraordinary to watch her grow, and she started regressing in speech. Her daycare worker said it, her pediatrician said it. She was unable to put two words together, which you should be able to do. She only had about 10 words, maybe a few more, by the time that she was a little over a year, but then started regressing and part of it was because of the domestic violence, because of the physical assault. She was there. And because, we were able to get some resources, but because it took so long to get what we needed, she wasn't eligible, after the age of 3. That's how long it took. And then at the age of, so expanding it to the age of 4 would provide more assistance. Really, it should be greater than that, but I'll take it to 4 if it's not going to be, to 5 or 6 when they're actually able to get to preschool and elementary school where they have support services like that. But I basically had to become my daughter's speech therapist. I had to provide the services that my daughter needed because there were none for her age. So thank you. And now she's quite extraordinary. She knows words that I don't know, and she aspires to paint the White House pink and rainbow inside. That's what she wants to do for different reasons. She wants to change the ESA, the Endangered Species Act. So unfortunately, she doesn't want to take the scientist route like me, but she's quite extraordinary. But did get a rough start. And we figured it out. But if we had these resources, it would have reduced a lot of heartache, money, and would have been able to avoid my current situation, which I can explain later. Thank you so much.
Dr. Osterweil, thank you so much for sharing your family's experience and your daughter's strength. Are you here in support as well? All right, come on up.
I'm getting more friends as we go.
Yes, hi, friend.
Good afternoon.
Good afternoon. My name is Whitney King. I'm the CEO of Destination Family Services down in the Hampton Roads area. I also do consulting for the Autism Society there, and I definitely would love to support this motion. We have a working relationship with CHKD where new referrals are sent over to the Autism Society, and then we provide resources to connect them with other providers in the area. So there's definitely a need. I was smiled when you asked about the providers because I was like, I don't have a number, but the answer is yes. So I definitely hope you all move forward with this.
Thank you so much.
Thank you.
Are there any other folks who are moved to speak in support of this bill, who are inspired to? Are there any other folks who are there any folks who wish to speak in opposition to this bill? All right. You hope none. Delegate Ballard, Delegate Cole has her hand up.
So
Do you know whether, so this being a federal program, and so we're asking for an extension option, do you know whether the program as it exists has been affected by federal cuts or threats for cuts or changes in reporting for the program?
Madam Chair, to the delegate's question, I have no idea. I have no data on that one way or the other. I'm sure it's publicly accessible, whether that's happened or not, but I couldn't tell you as I stand here today.
Council, is that something you are aware of?
Madam Chair, Delegate Cole, I'm not 100% sure if IDEA falls under HB1. I know there were cuts to other to Medicaid programs, and there is some overlap there, but I'm not 100% sure about IDEA, which is under the Individuals with Disabilities Act. And also to offer some additional clarification. So currently, we offer IDEA Part C to infants up to age 3. When they turn 3, that coverage ends, and then when they start school, they become eligible for Part B. So the extension option here would be to make it starting at age 3. That coverage would last until they were 4 years old, and it would terminate, I believe, when they start school the year after they turn 4.
Thank you, Council. All right, are there, I don't see any other questions. Delegate Henson?
Thank you, Madam Chair. Speaking to the bill.
You have the floor, Delegate Henson.
Thank you. I just want to explain that I do plan on making a motion. Hopefully it gets a second. I do know that it has to get referred to appropriations. But I will be throwing up a no vote, so then that way you have time to get those questions answered that the chair has asked for. So don't be surprised if you see me in that appropriations subcommittee writing down and jotting down that information. Thank you, Madam Chair.
Thank you, Delegate Henson. I just want to make a reminder to all of our committee members, if you make the motion to report and refer this bill, you also need to support that motion in your vote.
So there you go. Make the motion.
I'm a no.
Madam Chair, I think he's committed now. He has to vote for it.
All right. Well, I will speak, just speaking to the bill, you know, I have one of my children who benefited from early intervention services, and I think it's an incredible service that families are able to tap into. I think you do have to, even if you move to 3, there's still that gap, you move to 4, there's still the gap between 4 to 5 when kids do enter school for the Part B that Council spoke about. But also I think we have to weigh at some point, right, expanding the eligibility pool, making sure that there are enough service providers who are getting paid at good reimbursement rates so that they are providing those services so that everybody is able to get what they need, right, in terms of services. Delegate Cohen.
Madam Chair, at the appropriate time, I'd like to make a motion.
I think this would be a great time, Delegate.
I make a motion to report and refer to appropriations.
Second.
Right, there's been a motion to report and refer House Bill 103 to appropriations. Madam Clerk, I wonder if our technology is catching up with us today. Amazingness. All right, let's see if it works. Cast your vote.
It works. Thank you.
Perfect.
I shut it down.
All right, please close the roll, and this bill passes the subcommittee by a vote of 5 to 1. Delegate Ballard, thank you so much, and if you're able to get some of those points for our conversation in full committee, that'd be great.
I will, Madam Chair.
Thank you so much.
Thank you.
All right, Delegate Reed. This is before us, we have House Bill 136.
Thank you, Madam Chair and members of the subcommittee. House Bill 136 before you was given to me by former Delegate Candy Munden King as she got promoted to Secretary of the Commonwealth, and she asked me to carry this on her behalf. This bill would direct DMAS, the Department of Medical Assistance Services, to determine the feasibility of participating in an optional Medicaid benefit for sickle cell disease. The second part of this would also ask for them to determine the feasibility of establishing Medicaid health homes to coordinate care for individuals with sickle cell disease. If you're not familiar with that, it's not an actual home, but it's basically a collection of services because this is such a debilitating disease that it brings all of those things together and it can be covered under Medicaid as an optional service. And these optional benefits would be designed to be able to address both the unique and chronic and high-cost needs of people living with sickle cell disease. So this is a request or direction to DMAS to be able to determine the feasibility of including that as part of our current Medicaid plan. That's the gist of the bill, Madam Chair.
Thank you so much, Delegate Reed. Are there any questions from our committee? And if we were to act favorably on this bill, it too would have to be referred to appropriations, just a heads up. All right, I don't see any hands up. Are there any folks in the room who would like to speak in support of House Bill 136? Are there any folks who would like to speak in opposition to this bill? Okay. Committee members.
Madam Chair.
Yes, Delegate Henson.
I didn't know if you asked for more questions, but is there appropriate time for a motion?
Yeah, I don't see anybody with hands up for questions on this bill.
Thank you, Madam Chair. Madam Chair, I move to report and refer House Bill 136 to appropriations.
Second.
Right, there's been a motion that's properly seconded to report and refer House Bill 136 to appropriations. Thank you so much for opening the voting technology. Madam Clerk, please cast your vote. I think you can close the roll, and Delegate Reed, this bill will reports out. Oh, that was so fast. Unanimously by a vote of 6-0.
All right, thank you, Madam Chair.
So
thank you,
much.
members of the subcommittee, and I know that former Delegate Munden King also appreciates your support. Thank you.
Thank you for carrying on the torch to help individuals with sickle cell disease. Delegate Downey, welcome to the Social Services Subcommittee. And I hope all of our subcommittee members will join us in wishing the delegate a very happy birthday.
Thank you very much, Madam Chair.
Have House Bill 525.
House Bill 525. Thank you, Madam Chair and members of the committee. I'm pleased to present House Bill 525. This bill is a personal passion of mine as my pediatric clinic has been participating provider in the Reach Out and Read program ever since I've been working with them for over 20 years. This is a Section 1 bill that directs the Department of Medical and Assistance Services to initiate the process of expanding the Reach Out and Read program, which I'll describe further, to clinics serving children currently in underserved communities. Reach Out and Read provides a book to children from birth to 5 years of age at each of their well child visits, which my quick math was almost 14 books by the time they reach kindergarten. So for some families, that's all the books they get. By providing books at primary care appointments, pediatricians promote early literacy and parental bonding between children and their parents. Reach Out and Read is an in-demand program in Virginia. There's numerous clinics around the Commonwealth that are on the waiting list. However, many of these clinics do not have access to the program due to the lack of funding. For example, at CHKD, we get a lot of independent philanthropy people that donate to it, but the underserved communities don't have that support. So this would help provide that. In addition to promoting childhood literacy, Reach Out and Read has been known to improve children's attendance at their well child visits, which allows us to better provide preventative care and identify developmental problems at an earlier age. Parents are 2.5 more times likely to read with their infants, toddlers, and preschoolers as a result of this program. It provides a healthy alternative to screen time, or in my household, we call that glowing rectangles, and helps educate parents on how to integrate books into their daily routine. Furthermore, this keeps children on track as their language development oftentimes is improved by 3 to 6 months. The benefits of expanding the Reach Out and Read program are measurable for Virginia children and their families. By passing HB 525, DMAS will be given the necessary permission to support pediatric and family practice clinics in the most underserved areas who are waiting for the Reach Out and Read program to implement in their clinics. So if it'd be the pleasure of the committee, I would love for you to support this bill.
Thank you so much, Delegate Downey. Are there any questions from our committee members? Delegate Cohen.
Madam Chair, not so much a question as just a thank you. We have a clinic in my district that is on the waiting list and big believers as well. And I think it was really amazing to me to learn as a teacher that while evaluating third grade reading level for efficacy for what those kids will turn out to be and how well they'll be able to do is still really important. The biggest determinant of their literacy acquisition is actually if they have a home library with 50 books or more by the time that they're in third grade. So this goes a long way towards getting them there, and I couldn't be more thrilled to be a big proponent of this program. So thank you for bringing it.
Thank you, Delegate.
Thank you, Delegate Cohen. I see Delegate Henson has his hand up.
Thank you, Madam Chair. Just a quick question to the patron.
Yep.
Would this be your first bill out of a subcommittee? Nope. Oh.
It would be the second, if he got this out of the subcommittee, the second on his birthday.
Yes.
Are there any questions? Yes, Delegate Walker, this bill would have to be referred to appropriations if we act favorably on it.
At the appropriate time, I'm sorry.
Go ahead, Delegate Cole.
At the appropriate time, can I make a motion?
Yeah.
I move to report and refer.
Second.
All right, there's been a motion to report and refer House Bill 525 to appropriations. It's properly seconded. Please open the roll, Madam Clerk. Committee members, please vote. All right, thank you so much. Please close the roll. And this bill passes out of our subcommittee by a vote of 6-0. Congratulations, Delegate Downey. All right, one left from our very own committee member, Delegate Cohen. Would you like to present? Oh, she's up already. So present at the podium. All right, ladies and gentlemen, before us we will have House Bill 469.
Thank you, Madam Chair. House Bill 469 is requests that DMAS amend their regulations related to autism competencies checklist to include positive behavior support facilitators as trainers of direct support professionals and direct support professional supervisors. This addition of positive behavior support facilitators to the list of individuals able to provide training is meant to address a gap in who is able to train the folks who support the individuals with developmental disabilities and their families. This comes endorsed by the Disability Commission, but I just want to use this as an opportunity to plug how important our commissions are. This actually came from Ms. Whitney King, who just testified in favor of Delegate Ballard's bill, who just sort of casually mentioned during a Disability Commission meeting, hey, this is a real problem that we face, and we're trained to do this, but in code, we can't. And so just a reminder that sort of sometimes the casual conversations we have around these commissions really lead to something pretty amazing. So I know that she's here to speak about it, but this bill has been endorsed by the Disability Commission, and we're hopeful today that you all will be able to support it and send me on my way to appropriations.
Thank you so much, Delegate Cohen. Are there any questions from our committee members? Okay, I don't see any hands up. Are there any folks in the room who wish to speak in support of this bill? Hello, good afternoon and welcome back.
Hello again. Again, my name is Whitney King. I'm with Destination Family Services located in the Hampton Roads. And thank you, Delegate Cohen, for bringing this to the floor. Again, it's simply amendment to include positive behavior support facilitators. This is a training that I can do in my sleep, again, because of what I'm sure was an oversight. Positive behavior support facilitators were left out of it. We currently provide therapeutic behavior consultation, so it goes along with that. And in doing therapeutic behavior consultation, we conduct trainings. It's a part of the service to write behavior support plans and provide trainings. So this just allows these professionals to also conduct this training on the record.
Great, thank you so much.
Thank you.
Good afternoon.
Good afternoon, Madam Chair, members of the subcommittee. Ashley Wright, representing the ARC of Virginia. Want to align myself with the comments of the former speaker. Thank Delegate Cohen for bringing this forward, this very permissive bill forward, and of course we support the bill. Thank you.
Great, thank you so much. Are there any folks in the room who wish to speak in opposition to the bill?
Oh, they wouldn't dare.
All right, I don't see anybody here with their hand up. Delegate Henson.
At the appropriate time, I have a motion.
All right, are there any questions remaining from the committee? All right, Delegate Henson.
Move to report and refer to appropriations.
A second.
There's been a motion to report and refer this bill, House Bill 469, to appropriations. It's properly seconded. Madam Clerk, if you can open the roll. All right, Madam Clerk, if you can close the roll, and this bill passes the subcommittee by a vote of 6-0. Thank you so much. And that, ladies and gentlemen, concludes our first Social Services Subcommittee meeting of 2026, and we'll see you next week. Thank you.